Great day for everyone. We have a beautiful subject that is psoriasis. It is related to dermatology and to rheumatology. So let's start with risk factors, genetics, and epidemiology. So over 2 million of Americans and over 100 millions of people worldwide are affected by psoriasis. It can be transmitted to offsprings in 40% of patients who have a history of disease. And what as other risk factors like psychological or physical stress, infection, any type of infection like bacterial, viral, or fungal, drugs like beta blockers, anti-malarial, lithium, etc., smoking and alcohol. It's a special part because they can be cessated and it prevents proliferation and expansion of the lesions of the patches on the skin. What is the mechanism of the psoriasis? It's abnormal and excessive proliferation and rapid growth of the epidermal layer. This one is epidermal, and below you see a dermal layer of the skin, like simulating. And this is a basal layer, and from this layer stem cells or pluripotent cells are proliferating and going to the corresponding layer. And if they are synthesized a lot of keratin, and this one will be deposited under the upper layer, so you'll see the corresponding patches, scaly, and corresponding to psoriasis. So these ones are DNAs released from diet cells. It's an inflammation. Other than cells, you can see cytokines, you can see many inflammatory cells like dendritic and T cells also involved in these patches. What are the clinical manifestations? So mostly involved are parts are skin. So you can see red dry lesions, silvery and scaly plaques. They are very itching, especially in the exacerbation of the disease, and skin pain. Where are they located? On extensor parts of the body, mostly, elbows, also knees, and you see here a scalp, also lumbosacral region can be involved. Affection of the nail. So you see here a pitting nail. It's like this in the nail. Oil spot is the deposition of the matrix of the under the nail of the inflammatory response. Discoloration, crumbling nail, onycholysis. It's lifting of the nail plate. So if normally it could be like this, in psoriasis you can see some lifting of the nail plate at the end. Arthritis, a characteristic arthritis, as you know, this picture is similar to dermatomyositis, but pay attention, in dermatomyositis you can see only velvet color, but not deformities of the distal part of the phalanges. So morning stiffness, more than 30 minutes, almost patience, deformity of the distal phalanges, and dactylitis is like a sausage digit. You can see this on a X-ray. Diagnosis is made clinically mostly. You see these patches, you see a patient itching of that part, and respective risk factors. So it is called the Auspitz sign, a pinpoint bleeding when scale is scraped. If to consider this part was covered by some plaques, and we remove this one, we remove these plaques, you will see like a pitting pitting hemorrhage or bleeding, pinpoint one. Histologically making biopsy of the lesion, and we see a parakeratosis or hyperproliferation of the keratin that is lodged in the outer part of the skin. Thickening of the epidermis, this one is epidermis, and you see a thin dermis, and neutrophilic infiltration in the stratum corneum. Also, here can be infiltration with T cells and dendritic, as it is inflammation and autoimmune disease, of course. One X-ray of the hand, we can see a pencil in cap. So this articulation seems like normal, but look at the next one or nearby. You can see a pencil-like figure that is characteristic for psoriasis. What is the treatment of the disease? First of all, we are going to treat this with topical steroids like triamcinolone, betamethasone, clobetasone, vitamins D and A analogs like calcipotriene, and vitamin A analog that is tazarotene or isotretinoin, coal-tar preparation, tacrolimus and pimecrolimus. It's interleukin 12 inhibitors. For extensive disease, we are using UV lights and tumor necrosis factors like adalimumab, infliximab, and last one is methotrexate. That all of them are useful if we are cessating some risk factors. We are removing drugs that are used, we are cessating smoking or alcohol, and we are giving topical and even IV or per oral drugs. Thank you for watching. Hope this is useful for you.